Hi, I'm Dana Brigman. I'm a wellness educator for dogs and a dog trainer. I'm here to help you get proactive with your dog's health and natural wellness to save you money on vet visits, improve your dog's quality of life, and fully enjoy your well behaved dog. Over the years, I sought many answers for why dogs were struggling with so many behavioral and health issues. I found some amazing answers in nutrition and natural wellness. My goal today is to leverage every available modality to help us achieve long-term results and a thriving, healthy, happy dog. Hi, I'm Dana Brigman of the Canine Coach Carolinas. You can find me on the internet at caninecoach.dog. That's letter K, number 9, coach.dog. You can also find me on Facebook at the Canine Coach Carolinas or in our group that is designed to teach dog mamas just like you more about nutrition, essential oils, homeopathy, and other areas of natural wellness. We want you to learn all that you can to keep your dog happy, healthy, and thriving. I hope to see you in our group soon. Hi, everybody. It's Dana Brigman of the Canine Coach and Dr. Barb Fox. And I'll let her share her information quickly here in a minute. But today we're going to be talking about first aid. And Dr. Barb, I'd like to welcome you and thank you again for continuing to do these topics with me. I know that the people who listen to them are taking away a lot of really valuable information. So appreciate that and look forward to today's topic on first aid.
Thank you, Dana. It's really a pleasure to be here. We have such great conversations, and I just am so excited to share the information. So for those of you who do not know me, I'm Dr. Barb Fox. I'm a holistic veterinarian. I've been in practice for about 27 years, and I reside in Northeast Iowa. And we live on a farm with horses and cats. We do not have a dog at this time, simply because my husband and I travel so much. We don't feel like we have enough time to devote to that, but I see dogs every day in practice. So, I get my dog fixed that way. I started out doing holistic medicine or holistic veterinary medicine after I had a very serious health scare back in 2007. I was diagnosed with breast cancer. And it was on this journey that I chose to go, a long story short, and I'm not going to go through the whole story, but I saw my mom die from uterine cancer 3 years, or it was 4 years before I had my diagnosis of the breast cancer. And I saw Dana, I saw her go through such horrific stuff with the chemo and radiation and even the surgery that I thought there's no way in heck I'm ever going to go through that if I get diagnosed with the C word. And sure enough, I had to make that decision. But actually it was a blessing, because with me not going through conventional treatments, except for having the lump removed, I did not have any other extra tissue removed. It was just the lump. It showed me that my body could be healed by myself and my creator if I give it the right tools, like eating right, essential oils, homeopathics, good supplements, an attitude of gratitude, and all that. So when I saw my own health change, I decided to try, what can I do for the animals, since I had this amazing transformation. And that's how I got into holistic medicine. And so it's been my passion for like the last 14 years now to share this information with everybody.
So Dr. Barb, I know when we were talking about planning this topic, and I mentioned first aid, I forgot to mention that really what we started talking about yesterday was people who are fearful of trying natural wellness, right? They're afraid to not go down the route we've always been taught to be on, right? This traditional path. And so you must have had that moment of, oh, I'm making a big decision here not to follow traditional medicine and to do something completely different than that. And that must have been a fearful moment. How did you approach that?
Well, Dana, after hearing the horrific things that people have gone through with conventional treatment, I already had a whole health list, mile long of things wrong with me anyway, like severe allergies, acid reflux, fibromyalgia, asthma, and I've had such severe allergies in the past that I thought there's no way I would survive the traditional treatment anyway. And then I had in the back of my mind, if I have to die, I'd rather die with dignity than going through what my mom went through. She ended up in a psychiatric ward at the teaching hospital in Iowa City, Iowa, because she had such horrific side effects, and she was also had Parkinson's disease. The meds fried her brain. So it was kind of a no-brainer for me to just dive in. I knew people had survived cancer. I mean, you look at Lance Armstrong, he was one that I read his book. That was the very first book I read when I had my diagnosis, and it gave me hope. Even though he went through the traditional treatment, he had this pit bull attitude that he was not going to succumb to that diagnosis. And that's where I was too. It's like, oh, hell no, I've got a lot of stuff to do. I have great purpose yet. And so there's no way I can leave this earth.
Yeah.
And that was just my journey. A lot of people that don't survive it, or even animals that don't survive it, don't have a strong constitution. They don't even have a strong will. It's kind of like my massage therapist sorry for this long story, but I think that people can resonate with this. I started seeing a massage therapist that really did some of the deep tissue because I had fibromyalgia in the past. I thought he could really help me. And I ended up going to him as a massage patient or client for probably 3 years. But when he was 27, he had a twin brother. Now, the massage therapist was diagnosed with testicular cancer when he was 27. His twin brother had the same diagnosis 6 months later. Cal, my massage therapist, had oh, heck no, I am not leaving this earth. And he started doing Ironman races and triathlons and, getting himself physically fit and saying like, no way.
And mentally
and his brother
fit.
Yes. And his brother, who said, oh, woe is me, I guess that's my destiny, he died within 8 months. And Cal, he's still alive and he's in his late 70s right now. So, I mean, and that's just, right. When you talk about mental preparation, this is so important in disease.
Yeah. So I know I see a lot of people when I'm talking about natural wellness that are really afraid to step into that world. There's this whole fear of it's not going to work, which I think is the lesser fear than they have of it's voodoo or it's going to make my dog sick. It's going to be worse. It's going to kill my dog. Right. Where do you think this fear people have about natural wellness is coming from?
I think the media has a lot to do with it, Dana. I mean, you think about it, we've been brainwashed from the get-go that pharmaceuticals are the only way to go. And if you, in your doctor, so many people empower their doctor to take over their own health. Your doctor doesn't know you like you know your body, or your veterinarian doesn't know your animal like you know your animal. So I think the fear, it comes from one thing, habituation. We go to the doctor or you go to your veterinarian when you have an issue, rather than trying to find out what can I do to support this animal's body so that it can heal itself. The power that created the body heals the body. It happens no other way. That was a mural that was in my chiropractor's office, and it's like, wow, how true is that? Because we can take an aspirin and get rid of a headache. We can use an essential oil that has anti-inflammatory properties and get rid of an ache or pain. It all depends on if you want the chemical route or you want the natural route. And I opt for the natural route as often as I can. I'm not going to say that I think the only medication I've taken since I had the cancer diagnosis, I took a couple Benadryl when I got into some mold a few years ago, and I could not breathe because of the mold. It was affecting my lungs. Of course, I was doing the tenting with the essential oils and everything and inhaling them, diffusing them. But to get that allergic reaction stopped immediately, I took a couple of Benadryl. It didn't kill me. I wouldn't be on Benadryl forever.
Right.
I wouldn't take prednisone forever. But, so there's a little balance there. I think if people start to see, if they could really hear the truth about what some of these medications and procedures do to an animal's body or even your own body, I think most people would opt for the natural route. but again, I think it's habituation and brainwashing a lot, that they think that they have to go to the vet and they have to go to the doctor instead of empowering themselves to take care of the issues at home. Does that make sense?
It does. And I think you made an important point that I want to not clarify, but reiterate, I guess, is that you nor I are saying it's only natural wellness all the time.
Right.
There's a time we need intervention in emergency veterinary care or human medical care. And sometimes we might need a Benadryl, right? Benadryl is in my first aid closet too, but it's not the thing I go to first unless it is some major crisis. Like I had a little dog one time that stepped in a bed of yellow jackets.
Oh no.
And they were swarming all around him. And I'm thinking, how am I even going to get to him without me just getting all, and honest to God, I took my shirt off standing out in the yard. So I'm flinging, trying to get yellow jackets away from me and him. I called him to come. He shot out of there straight to me. I ran in the house and I slammed Benadryl down his throat. He was a wire-haired, oh shoot, I can see him, little Baxter. It'll come to me. Jack Russell. And so I'm pulling yellow jackets out of his fur. They're all tangled in wire hair. I'm ripping those out. I grab a new shirt. I take the bottle of Benadryl with me because I knew we had to get him to the vet and it was quite a drive. I pushed more Benadryl down his throat. By the time we got there, his gums were pale gray and they said, have a seat. I'm like, no, he's dying right here. His gums are gray. And as soon as I said those words, she knew that it was more extreme, right? It took 2 Eppies to save him. 2. This little bitty body. But I mean, again, I just want to say neither one of us are saying it's all or nothing all the time. And there are times that I think we need to help people feel comfortable trying the natural wellness so that they can start to see the results. Because if all you ever have to fall back on is all you've ever known, you're never going to see firsthand the benefits of having a really great essential oil collection or homeopathic collection or whatever that may be.
Right. And the same thing with, no, that's fine. I love that story. You know, you hit upon a really good point, Dina, about having this like natural emergency kit on hand, because there are times when, like you said, you have to drive maybe an hour to see your veterinarian. Maybe your veterinarian's gone and there's no other emergency clinic, and man, then you're up a big creek right there. But the thing is that I never, like I said, going back to emergencies, I do integrative medicine. I tout myself as a holistic veterinarian, but most holistic veterinarians do some medical intervention of some kind. If I have a dog with 104.5 fever and he's got oozing, weeping sores on his body from whatever, he's going to get an antibiotic. He's probably going to get intravenous fluids, and he's going to get some steroid therapy to get him out of that crisis, just like with your little guy. And yes, there's nothing wrong with thinking that way, but I think a lot of people do it backwards too. Is that we don't look at prevention or keeping our animals above this wellness line that we talk about every now and then. And then we wait for a problem to happen, and then we resort to having to use medication, whereas maybe if we fed the proper diet, we gave daily supplements and essential oils that could keep that animal healthy, then we don't have that emergency crisis. So
most of the calls I get are something's wrong right this minute, right?
Yeah,
and
right.
Real sense of urgency, and for the people who are like, well, what can I do? If you don't have anything on hand, we're kind of screwed, right? The only thing you can do is the more traditional routes of things. And so I really try to encourage people to start 1 or 2 things at a time. Just start building your collection and work your way into that. And so I think that's where we're headed today, is to talk about some of the things they can start with and do at home and really start to lessen their fear and increase their confidence in knowing what's possible, what to do when, and when to bring in the more traditional approaches.
Sure. Yeah. Okay.
With that in mind, you mentioned that we have essential oils that have some antibacterial properties or antifungal properties. What are some of the things essential oils can do for us?
Well, first of all, Dana, let me start by saying that when we were talking about essential oils, we have to think of quality, especially with our animals, because so many of the products out there are extended with, an extender, a chemical extender of some kind. That means that instead of taking the pure essential oil and leaving it alone, they'll add something with it to make the volume bigger, and it takes away a little bit from the efficacy. Also, some of these chemical extenders can be harmful to our animals. The other thing is if they are adulterated in other ways, and there's like 9 or 10 different ways that essential oil companies can either create a synthetic oil, they can add a non-organic oil to an organic oil. There's so many ways. That's another workshop another day. But going back to the quality it's like when our animals are breathing this in, their sense of smell is anywhere from, I've even heard up to 1,000 times more sensitive than our sense of smell. And if they're breathing in some chemicals, they're going to be affected a lot more than a human would. So just because something smells good to you and it was cheap because you bought it at the natural food co-op or whatever, does not mean it's quality oil. Now, and I know, we both know that Young Living essential oils is probably the best, or I should say not probably, but it is the highest quality essential oil company out there. They have the seed to seal process, meaning that the plant is taken care of the way it should be from the time actually the soil is prepared the way it should be, the planting is done the way it should be, the harvest is done at the correct time and correct temperature, and then the essential oil is sent out for third-party laboratory testing to make sure everything is good, quality control is superb, and then we bottle the oil. We don't send it out somewhere, buy oils from a broker, somewhere on the black market that somebody else has gotten rid of because it's not a good oil. Yes. So anyway, saying all that, Young Living has that good quality, the highest quality oils that are out there. So just if we talk about essential oils in general, like generically, essential oils, there are some that have antifungal properties, like you said, and a lot of them have antibacterial and antiviral properties. And so being that I mentioned Young Living and essential oils in general, going to be a little compliant here because the FDA doesn't like us talking about these kinds of things simply because they're not labeled for what we're claiming. But there's plenty of resources out there. If people want to know more, they can buy some books. They can. There are a lot of good guides out there. So where were we on that? I kind of went down a little rabbit trail on the quality.
No, that's all good. But so let me back up. Before we jump into using essential oils for first aid, what are some of the things we need to keep in mind when it comes to doing anything at home for the first aid?
You mean like an urgent care kit of some kind?
Yeah.
Well, I would encourage people to have a stethoscope. It doesn't take a rocket scientist to put a stethoscope, in your ears. You don't even have to really know what an arrhythmia is or what a heart murmur sounds like, but we want to know if the heart is beating too quickly. So a lot of animals, and it's hard because they're too. Here, I'm just going to make this really simple. I was going to go into a little spiel here, but I'm going to make it really simple. If people would go online and know for their breed or what size dog they have, what a normal heartbeat is, or how many beats per minute, because the small dogs are obviously going to be different than the big dogs, but you can get a chart, copy it off, and have it at home. Basically, how I teach clients is where to put the stethoscope, like right behind the elbow on the side of the chest, and they ought to be able to hear a good heartbeat. If it's really faint or if it's really pounding strong, that's an issue. So stethoscope is number one. Also, having a digital thermometer is really good, and a little jar of Vaseline, because you don't want to put that thermometer in that little doggy's rear end without some lubrication.
You would in an emergency if you had to.
Right. Or you could you can use a little spit too. Okay. Sounds gross, but large animal doctors do that all the time. Anyway, a normal temperature in the dog is between 100 and 101.9 or even 101 or 102. It also depends if they've been out exercising in the hot weather, they're going to have a little higher body temperature, but somewhere between that 100.0 to 102.0 is normal. And puppies run a little bit higher, so not a big deal there. The other thing that I would suggest having is some gauze or some vet wrap. If your dog has a bleeding wound and you need to take it to the doctor to get it sutured up or at least looked at, it's good to keep that covered so you don't get extra dirt and you're not going to have blood all over the place. So you can buy Talpa Pads, and these are like gauze with a little plastic coating on them so they don't stick to the wound. And I buy mine, and I think you can buy them in pretty much any drugstore. And I keep those on hand here too. You want to be able to, well, I'm trying to think of what we could probably go through a whole emergency kit here. Those are the main things that I would, and just bandage materials, bandage scissors. Now, these are special scissors that have protection at the end. They're nubbed off so that they don't cut the skin when you're putting a bandage on or taking a bandage off. But any kind of bandage material, good, cotton balls, even swabs if you've got a, like, for example, taking a tick off. And here, I'm going to say people, I see people come into a vet clinic, pay $80 for an office visit to have a tick removed because they don't know how to do it. They're afraid to do it. And I'm saying, you know what? All you need is a little peppermint oil and a cotton stick or a cotton swab, and just saturate the end of that cotton swab with your peppermint oil. Stick it right where the tick is attaching to the animal's or the dog's body. I guarantee you, if that tick is still alive, it's going to back out in a hurry. And then you have the analgesic effects of peppermint because of the menthol in there. And so you're going to get a little anti-inflammatory effect from that. So that's just a really good example of how you can save $100 by going to the vet. Okay. Woohoo. And on that tick where it was attached, what I use is Young Living's Purification. The name says it all, right? Even tea tree oil. And tea tree oil, if it's a good quality tea tree oil like Young Living's, it's not going to be harmful to your animals. So,
okay.
Yeah. Well, those are some things. Yeah.
When I mentioned the little dog's gums that were gray, a lot of times people will, and I don't know the term, when you press down on the gum and you're looking for it to sort of come back to color quickly. What is that term?
It's called capillary capillary refill time.
Yep.
That just
what
means that when you push in
there?
less than 2 seconds, preferably immediately. Okay, so anything over 2 seconds means that animal's severely dehydrated or in shock and needs to be seen for fluid therapy and emergency care.
Awesome. Okay. So so let's talk about some of the first aid topics, right? Mm-hmm. You look like you might have a list. I have a little list. We'll see if they all overlap. But, I guess one of the first things that comes to mind is you have a dog and all of a sudden he comes in and he's got some little scrape on his arm, or, he's run into a stick or whatever, and he's got a little boo-boo on his arm. What are the things that we can use to sort of clean and help the healing process of those things that don't require stitches or, veterinary care in those moments?
Right. So if you go to the drugstore, you can buy some saline. It's just salt water. Basically, it's the same pH as our body, and saline is really good for cleaning up a wound. You don't want to use straight water because it's got a different pH and it's going to burn a little bit. So I always use sterile saline. But Young Living has that collection. Do you know what that collection is, Dana? The three animal sense oils. The first one is called Pure Clean. Now these names say it all. So Pure Clean, you would use that as your number one oil, and then the second oil you would apply to that scrape or cut would be Infect Away, and then the third oil you put on is Mend Well. And if I recall, these are not expensive essential oils at all, but they are excellent. They're already pre-diluted, so you don't have to do any more diluting unless there's, an animal's really sensitive to it, especially a really tiny dog. You might want to dilute it out with a little olive oil or coconut oil. And I love coconut oil because it already has anti-inflammatory effects. So when you're using that, you're taking a little bit away the sting and the inflammation that's around that cut or the scrape or whatever you've got there. The other thing that you can also use, this is another Young Living product, it's called Owie. And it's the Kids Sense oil line. And again, the name says it all. It's all for little boo-boos that happen. And then, of course, lavender is always a good one. I have two oils that I would suggest everyone have as kind of their Swiss Army knife collection. And what I mean by Swiss Army is they're good for everything. Lavender and frankincense.
Yep, exactly.
Because, you can use those two. And in even more serious situations, I would suggest having some of the oils like Peace and Calming, Stress Away, because you're stressed as well as your dog that just got injured. Say like you've got a hit by car. You're on your way to the vet. You're freaking out. Your dog is panting in pain, maybe whining, crying. You've got to do something to calm everybody down, because it's only going to make the situation worse if that emotional tension is there. Yeah. So I was going to show you, I think I showed you this before, but I'm going to show your audience here. This is a little kit I got. I don't even know what company I got it from, but I just went online and I looked for an essential oil emergency kit. Now it's got a little clip here, so you can put it on your purse, you can put it on a backpack. If you've got horses, any of your dog people have horses, you can clip it right onto the saddlebag. If your dog has a harness rather than a collar, you can probably find a little ring to put that on there. And inside, it's got room for 16 different essential oils. And each one of these little bottles holds about 40 drops. So I carry this on the airplane too. You never know. Every time even if you trip and fall, you've got your oils right with you. But I've got things like Cool Azul for pain and inflammation. I've got Aroma Seas if you've got a muscle cramp. I've got M-Grain, which stands for migraine, not for dogs, but I always carry it in case somebody around me has a really bad headache. I have Purification Oil in here. Aroma Life, which is good for if an animal's in shock. Panaway, perfect for little pain and inflammation relief. Peppermint, probably could be called another Swiss Army knife. Peppermint for bee stings, especially. Ooh, nice. Whoops, just had one fall out here. Trauma Life. Okay, we're thinking of the Trauma Life for the emotional aspect of injuries and
for everybody, not just the animal, for the human too, who's going, oh my God, what happened?
Yeah.
Yep.
Tea Tree. I've got Tea Tree. And then I have Lang Lang in here. Lang Lang is, if you feel your blood pressure raising because you're upset or fearful or whatever, same way with the animals, I put Lang Lang on, just kind of, and it's immediate. The beauty of the essential oils too, and I know you know this, Dana, is that they work immediately. Even Digest, my husband, if he has a little heartburn, he'll just be complaining. I said, well, go get the Digest. Oh yeah. He doesn't think about that. I have to tell him. He'll put that on and in 30 seconds, he'll feel 100% relief. And then he's even the one that goes, oh my God, that was crazy. That works so fast. But yeah.
So when we've used essential oil, and I'm getting way off, I'm all over the place today, but
that's all right
on my brain, and our calls go better when we do this. If I have a dog that has broken a leg or hit by a car or major puncture, and I've started to use essential oils on that dog en route to the vet, and this is not to say essential oils stop us from going to the vet, right? Emergencies require us to
Right.
go. But we may be doing some life-saving measure, frankincense or helichrysum in a bleeding wound, or, you know, things of that nature can be extremely beneficial en route.
Right.
What do we need to say to the vet about using the oils? I've heard that if they need to go in and cauterize something, that they need to be told we've put essential oils on the skin.
Mm-hmm.
Can you tell us what happens? Because people are going to hear, oh my God, my dog caught on fire. The oil caught on fire, right? And it's true. They have a flammable capacity, but we're not catching the dog on fire.
No, we're not. No. So could you repeat that? My audible just went out a little bit, Dana. Can you repeat that same question again?
If I have put like helichrysum in a bleeding wound, right,
Okay.
on the way to the vet, I need to tell the vet that I've done that, so that when they start to clean that wound, and if they're going to cauterize something, they understand part of what they're seeing.
Correct. Yeah.
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 I was trying to make that a question and I just made it a fact. So sorry.
Well, that's okay.
Sorry about that.
So
So
no.
let's talk about, can we use essential oils for punctures? We've kind of talked about that for the dog fights. Are there times that we don't need to head to the vet for those, you know, the dog tagged another dog on the leg, or maybe even bit its new foster, not enough that it requires, you know, all this medical intervention, but is it safe to use in those scenarios, and what oils might we consider?
Well, if we look at the oils that, and again, I would encourage people to buy a reference guide. The best one that I found is the Essential Desk Reference. You can buy one for animals. Yeah, they're going to be a little tough to find right now because the FDA has okay.
Mm-hmm.
They're going to be a little tough, but they're out there. You just have to contact some people that are essential oil gurus and find out where you can buy those at. But the essential oils that come to mind for me would be like a blend called Thieves. And that has rosemary, clove, eucalyptus, lemon, and rosemary. And if you look at the anti-cinnamons, did I say cinnamon? Okay.
Not the first time. You said rosemary twice.
Okay.
That's okay.
Sorry.
We got it.
Yeah,
We
I can't remember. Okay. But if you look at the antimicrobial profile of all of those oils, it's incredible. And so on a puncture wound, yes, you have bacteria that is entered into the dermis and down into sometimes even to the muscle, depending on how deeply the puncture went. There's no reason not to put something like diluted Thieves on that puncture wound as soon as you can. And then I would repeat that 4 to 5 times, because what happens is essential oils get absorbed through the skin and into the deeper layers of tissue, into the bloodstream, actually, Dana. So within 2 minutes or 20 minutes, every cell in the body potentially has an essential oil or a molecule of essential oil in that cell. Yes. So my horses oftentimes will step on something they shouldn't. And if I can get an essential oil on that area, right away, it's perfect. If a dog is in a terrible dog fight, obviously you're going to go get some antibiotics and you're going to get some emergency care from the veterinarian. But if it's just a superficial little puncture or a wound that doesn't look too bad, I mean, I even treat my cats with these essential oils, and everybody says, oh, don't use those in cats, they're toxic. Hello, I've been doing this for 14 years, all close to 15 years on every animal patient that has a need for an essential oil, which almost all of them do, and I'm not going to hurt them by that. Obviously, if I overuse these or use these incorrectly, or if I'm using a substandard essential oil, like an adulterated oil, then obviously I can cause some harm. But for the most part, I can tell people I've killed an animal using prescription medications at the recommended dosage. Mm-hmm. I hate doing that. I had that happen. It was a drug called Previcox that came out on the market. And this little dog came in for, I think he'd hurt his back, the little cocker, cute little cocker. And I gave him 5 days worth of this drug at the recommended dosage. The client did everything exactly right. A week and a half later, he went into an autoimmune hemolytic anemia, which is basically the body is destroying its own red blood cells, and it died. It happened so fast. And he said the only thing different was the drug. I can't prove that that drug did that, but I'm a lot more afraid of prescription medications than any natural substance out there.
Right.
I mean, that's just the way it is, because if you think about how the creator made this world, we were blessed with the plant world that has amazing healing properties. And so I'd rather go that route any day over a conventional medicine if it's not a real serious situation. And again, going back to that thing we talked about before, yeah, we need medicine at times, but oftentimes we can mitigate or even alleviate a situation without having to go the medical route.
Yeah. So, going back to our scrapes versus our punctures versus we need stitches, right?
Okay, right.
Should we bandage anything, and then should we use essential oils with a bandage?
That all depends on the severity of the cut or the wound, Dana, and that's so variable. It's hard to say, you know, put it all into one mold here.
Okay.
If it's over a joint, say like in the hock area on the front of the hock of a dog, and where that's below the joint, below the stifle, it looks like, you know, the pointy area. For people who don't understand what stifles or hocks are called, on the front part of that, it's a high motion area. And so it would be really impossible to keep that area sutured. So if you can work with your veterinarian to find the right way to bandage, and the reason I say the right way is that if a bandage is applied too tightly or incorrectly, or it slips and cuts off circulation, you've got a whole different situation there. You've got, yeah, we don't like that situation at all. Okay. If it is something that is in an area, say like maybe on the back, like a dog that has gone underneath a carburetor, whatever, and has got a burn on its back, you can make a t-shirt out of that just to keep, you know, the dirt and the germs out of that area as it's healing. You know, there are a lot of things that we can do, but bandaging has its, you know, we have to be cautious with bandaging, and some dogs will just tear their bandage off, chew it up, and swallow it. So then we have that situation. Yeah.
You mentioned the burns on the back. Sadly, in our area of the Deep South, we see a lot of dogs come in with burns down their back where someone has intentionally done it. And it's just tragic. But a lot of our rescue groups deal with that. And of course, you know, when you see something that severe, you begin with more medical care, right?
Right. Mm-hmm.
But there's a point, I think, that you can transition into using the lavenders and the ointments and the Mindwells and all of those things that can really continue, you know, help that healing process become perhaps even accelerated, you know.
Correct. So. Yeah. And I was going to say another one I would, you know, suggest you having your essential oil arsenal is Copaiba. Mm-hmm. Copaiba is phenomenal for elite. I mean, I've used it when I bruise myself or butt myself or burn myself a little bit, along with lavender and frankincense. And that combination seems to be super helpful. Mm-hmm. Copaiba is a really underrated essential oil. And because of its light scent and it doesn't have much taste, you can even give this to your animals, your dogs, I should say, orally, because getting the oral application in is important too. So if your dog has broken a tooth, for example, maybe you've got a little bleeding around the pulp area, get some Helichrysum and some Copaiba on that, and it'll alleviate a lot of the pain until you can see your veterinarian.
Yeah. So I think Copaiba is one of the best essential oils to have in your collection. I'm never without it. And so that takes me to the, you know, the athletic dog that comes in limping on his little paw like I've got a wound, right? Or the little dog that maybe has tweaked the back, or, you know, their little legs. I have 2 long backs myself. They've done it, you know, from time to time over the years. And never would I not ensure that we don't have a slip disc or something, right? Never would I
Right.
not take those steps if I truly thought that's what was going on or it was severe pain.
Mm-hmm.
But I've used bottle after bottle after bottle of Copaiba for those
Yeah.
kinds of things, you know, to
Good.
help with that. You know, my little knees tweaked, or, oh, I just don't feel quite as loose today as I should, you know, those kinds of things. What should we use when we're dealing with maybe the dog started to cough for some reason? And again, folks, I'm not talking about we need to rush to the vet because the dog's in crisis. We're like, I'm not quite sure what I'm seeing here. Is this going to linger, or, you know, is there something we can do to alleviate the issues and not have to go to the vet? But, you know, what is that period, Dr. Barb, that we say we're going to take some action at home, but if we're not seeing some improvement, we need to move out, you know?
Right. Well, with a coughing dog, it can be so many reasons for that. It could be seasonal allergies. It could be the air quality, like with the fires in Canada and out west. The Midwest has been getting the fallout. We've had very, very hazy skies. People are coughing. Animals are coming in coughing, and it's not kennel cough. You know, those are situations. Coughing can become from a heart murmur, but until you can get to the veterinarian, and know so many veterinary clinics are overrun right now, triple and, you know, sometimes double and triple booked with medical cases. I've had those days at this clinic that I fill in another town. But anyway, and if you can't get your dog in immediately, some of the oils that I would think about using for that, you know, that irritation and just to soothe that respiratory tract would be like eucalyptus, any species of eucalyptus. Young Living has a pre-made blend called Breathe Again. It comes in a roller, and you can roll that on your dog's chest or around the throat area. Raven is another one. It's and then RC stands for respiratory congestion. So there are a lot of things that you can do with the oils. Peppermint too. You know, just diffusing these is the best way I found, Dana, you know, for these types of situations. I do apply them topically, but you also want to have those diffusing in your house as well. Mm-hmm. Some of the other things, again, Copaiba, and then lavender hinoki is another oil that Young Living has. It's Hinoki, and it is supposedly good for soothing that respiratory tract as well.
Yeah. So what about things going on with the eyes?
Like what kinds of things?
Well, the eyes are starting to appear a little goopy, or we might have a dog that's sort of squinty at us. You know, are there any things that I'm trying to lead you to an answer, and I guess I should stop doing that. But I guess the point that I want to make, and I want you to make, is we're never going to put essential oils in the eye, right? And that if we're questioning, is there something wrong with that eye, that is most often an urgent care kind of thing.
Most eye things, yeah, Dana, most eye things are urgent care. I can't tell until I stain the eye with a special dye if there's a scrape or a cut or a puncture in that eye. And it might be allergic. Sometimes they'll get a little plant on underneath the third eyelid. Mm-hmm. And so that takes a special procedure at the vet clinic to determine what's going on.
Yeah.
For the most part, until you can get to the vet, what I do, I'm just going to demonstrate on my eye here, is I would take a little drop of essential oil, say like even Valor, lavender, Helichrysum, and just go like this, right under the eye. Don't use peppermint though, you will kill me.
Mm-hmm, okay? Mm-hmm. I've done that. I've done this and wiped it right.
Oh, yeah. But just putting it right under the eye allows those vapors to hit the eyeball surface. And my husband, this is a really freaky story. I got to tell you this one though. My husband and I don't go to the doctor. We just don't go unless it's a dire emergency. And about 3 weeks ago, he got stung in the eye by a bee. He was just coming in the door. He thought it was like a little mini, like a baby mud dauber, but apparently this bee flew up under his glasses. He barely saw it in time. I mean, you know, just like bingo. And didn't know what happened at first. All he's doing is holding his eye and screaming at the top of his lungs and circling, like
Yeah,
to the
that
point where I
sounds
thought it's
really
going to,
painful.
yeah.
That's
And
awful.
and so I immediately got the oils around the eye like that. And then for the next couple of days, had him do those oils, in that manner. His eye got crusty. It was really wet, red. I'm starting to get like, holy moly, this is not looking good. And I'm not going to tell you this. I shouldn't tell you this, but I'm going to tell you what we did because I was getting so worried. Is I had some artificial tears, and I put 1 drop of Helichrysum in that bottle of artificial tears, and I had him put that in. I kid you not, 2 days later, no problem. Now that saved us probably $500 for an emergency visit, maybe more, or having to go to an optometrist or an ophthalmologist to get some eye medications that are probably anywhere from $70 to $80. So there are times when, yeah, you're not supposed to put essential oils in the eye, but Helichrysum is one that I know Dr. Susan has also used that in a really severe eye case where it was either take the eye out or try something different, and it healed the eye up. So, yeah.
Yeah. Yeah.
But for the most part, if you have an eye issue, see your veterinarian.
Okay. What about the upset stomach? We see that a lot, right? People are like, oh my God, my dog vomited. Oh my God, my dog had diarrhea. Oh my God, it was loose. I'm like, okay, it was once. It was one time. But
Right.
people are very protective of their dogs, and we'll rush to the vet more than we'll rush to the doctor, right? For us, we tend to be like, yeah, we'll wait and see what happens, but for the dog, they're panicked because the dog can't tell us, oh yeah, I got into something I shouldn't have eaten or whatever.
Right.
But what can we do for those, and how long should we wait to see improvement before we take action? Not take action with a natural wellness, but head to the vet.
Well, that's a good question, because if a dog is vomiting repeatedly, say like we've had the vomiting for 6 hours now, maybe every hour, or 6 or 7 times, and the animal's starting to get dehydrated, being really lethargic, then I would say, yeah, take it to the vet as soon as you can get in. If the dog has only picked up once or had a little bit of loose stool in the morning, by afternoon it's solid, I still have people that bring it in the next day just to make sure it's okay.
Yeah.
I think it's a little overkill, but people are really worried. Like you said, it's their dogs are their babies, right? I mean, my cats are my babies. And so I don't want anything to happen with them. But here's the deal. Vomiting and diarrhea is not always a bad thing. Like you said, Dana, if they got into something they shouldn't, this is nature's way of getting rid of it. So it doesn't cause issues. Puking and pooping out toxins, hey, fantastic. But if it continues more than 24 hours, that is something you need to address. But if you have those oils in your urgent care arsenal, like Digestive, the Animal Sense Paragize, or even the Kids Sense Tummy Jize, you've got really good things to work with.
Mm-hmm.
Now, Digestive for people it's if you smell the bottle, it's super strong, and a tiny bit really does the trick. I brought, like even a horse that's colicking, 1 drop in the mouth, it's resolved the issue. So you can see how on a 1,000-pound animal, 1 drop does. It doesn't take that much for our small animals. Yeah. But oftentimes, if it's because Digestive actually is a digestive essential oil blend, and it has probably, I think, 8 or 9 different oils in there, including patchouli, peppermint, ginger, tarragon. What am I forgetting here? Anise. But these are all things that support the digestive system.
Right. Easy for you to say.
Yeah, right. And so it doesn't make any difference what the digestive issue is. It's going to help support that body to get everything back to normal again.
I think I'm sorry, go ahead.
No, I was done.
I was just gonna say, I think it's a great one to have on hand in like rescue groups or traveling when you're off schedule or the dog's transitioning to a new food or any of those kinds of things. It's super helpful. my senior somehow, and I still don't have an explanation, but he got to the point last year where he did not want to eat his breakfast. He would skip that meal by choice. I mean, it was offered to him and he's like, I'll just walk away. And I'm like, something's up here. I can't quite figure out what it is, right? And so Digest was our go-to, to make sure he wasn't having some sort of stomach upset. That whole thing lasted, I don't know, 2 or 3 weeks. And if I offered it to him at lunchtime, he would eat it. And then he would eat his supper, but he just didn't want it early in the morning. And so I then got into the whole Chinese medicine thing of we need some warming things. His body wasn't awake yet, blah, blah, blah. We changed up some of the protocols there. And guess who eats his breakfast again, right? But people worry when their dog skips a meal that, oh, something's seriously wrong. And sometimes they just self-fast. Sometimes they just know that if I eat right now, it's not going to be great, or I don't want it now, or I don't need as much food as I once did. So this same little guy about a month or so ago, he was just fussy. And I'm like, oh, he's 18. And I'm starting to really get into that worried state that my days with him are numbered. And I know they are, but he was just miserable. And I couldn't quite figure out what was going on. And I happened to be talking to somebody who was an animal communicator. And she said, his stomach's upset. And I'm like, that doesn't make any sense to me. He ate his supper. He was fine. Guess who added more food at supper time because he skipped his breakfast? This girl. So his belly was bloated, right? He was miserable. So a little swipe of Digest on his belly and he settled down and went right to sleep. So
isn't it amazing?
Pretty amazing. Yeah.
And people want to just shove the Prilosec or the omeprazole, or I guess that is omeprazole. The Prilosec is the trade name, or ranitidine or cimetidine down them. And here we have a drug going in, chemicals in and if we can use those essential oils, for one thing, the essential oils work very quickly and it's not going to upset the acid balance in the stomach. And that's what those other products that I just mentioned do, is they cut out stomach acid. Then you have the issue of not having enough stomach acid to digest the animal proteins that they're eating. So we go oils first.
Yes. So what else is on your list? Or can you boil this down to like the top? You had 16 in your collection, but maybe the top 10 or the whatever oils that you recommend that somebody who is just getting started consider. And what are they used for? Generally, like the quick hit, use it for this.
First of all, I would have peppermint. If you have any, you need the respiratory soothing, you need a little bit of anti-inflammatory effect from that. Peppermint, we talked about that. We just talked about Digest.
Peppermint's also good for the dogs that are overheating in the summer.
Yes.
Outside too hot.
Yep.
Cool them down. Helpful for that.
Correct. We talked about Digest, and then we talked about Copaiba. Copaiba, highly anti-inflammatory. If you look at the beta-caryophyllene content in Copaiba, it's tremendous. And then our Swiss Army knife oils, lavender and frankincense. Frankincense, we didn't talk too much about, but frankincense, basically, Dina, has over 150 different components to it. And each one of these components acts on the body in a different way. And if you think about frankincense, if an animal's been hit by a car, it increases that will to live, may help the circulation a little bit. Frankincense really has been known for skin health in wellness. I use frankincense a lot for just basic wellness. And I'm trying to be compliant here, but even for digestive issues or even a little pain, I think frankincense can be very helpful. I'm just trying to go off the top of my head here because I did not make a list. I figured we'd just talk.
That's okay.
But let's see here. God, there's so many.
There are.
Oh God.
So, I mean, I've used frankincense on, like, when Poppy was going to get spayed, or when Howie had to have his eye removed. I swiped frankincense right down his little noggin in his back and sent him into surgery.
Yep.
The whole thing, right? They let you see him before they go. This was before the COVID and stuff. But, she's like, "What are you doing?" I said, "We're having a prayer." I just swiped right on.
Yeah.
Him.
That's crazy.
So, I mean, but why not?
Well, I have a really cool story about frankincense, and this is pigs, but you can get the idea of how potent frankincense is. So I was actually coming back from my Young Living meeting. I had my oil case with me. I was down about an hour away from home. I was about 6 miles from home, and I see all these emergency vehicles on the highway. I'm like, oh no, there's an accident. What happened was a semi-load of market weight hogs had tipped over in the ditch. And I tell you, I needed a bottle of frankincense for myself, just for the sight and the sounds. These pigs were screaming at the top of their lungs. There were some that were crushed underneath. I mean, it was a double-decker semi. And the emergency workers were trying to get the pigs out. They're having to cut the semi trailer apart. And it was horrible. Anyway, I had a brand new bottle of frankincense, 15 mLs. You know how expensive 15 mLs of pure, genuine frankincense is, okay? And some of the pigs were open mouth breathing, laying on their side. The ones that they had already gotten out, some were injured terribly, and some were just like overheating and from the shock. And so I grabbed the frankincense and I told one of the emergency workers, I said, "I've got some medicine here. I want to sprinkle on these pigs." He said, "Come on, whatever you need to do." And so I started, the ones who were open mouth breathing on their side, I would just open their mouth or I wouldn't have to open their mouth, but right on their tongue, lift up their tongue and sprinkle the frankincense in their tongue, on their head, anywhere I could. I went through an entire bottle of frankincense. And some of the pigs I couldn't get to because they were still in they were in pens, those little makeshift pens that I couldn't get to. I told one of the emergency workers, "You'll love this." I said, "Take this oil and sprinkle on those pigs over there." And he says, "What is this stuff?" I said, "It's medicine." Well, later on, I overheard him telling me there's some holy oil, some voodoo oil that this veterinarian had. But he did it. He went and did what he had. And I kid you not, the ones that I was closest to and the ones I could get to first, in 20 minutes, they were standing and they were rooting in the soil just like normal pigs do. Oh my gosh, of course, the ones that had crush injuries, their crushed chest or whatever, couldn't say, but I went through that whole bottle of essential oil. I'm thinking, oh God, there goes my, but if I could help those, hey, it gave those pigs a will to live. It increases the spiritual connection of any animal or any human to the creator and to spirit, whatever you want to have the name for, as God. And so this is why frankincense is so incredibly important. Another one that I forgot to mention, Dana, on an emergency basis is cistus, Cistus. It is also, the common name is Rose of Sharon. And what cistus does is a natural coagulant. So if you've got any bleeding disorders, you get cistus on right away. I know lavender has some ability, and Helichrysum does too, but Helichrysum can go either way. It can either be an anticoagulant or a coagulant, depending on what the body needs. Cistus is a little cheaper too, and it is basically, a great first aid oil to have. And then I would also have Helichrysum. I know it's expensive, but
it's
boy,
worth
I'll
it.
tell you what. Oh, no kidding. Yeah. And then I would also encourage everybody with animals, especially dogs, to have the Pure Clean, the Infect Away, and the Mend Well. It's a very affordable little 3-part collection, but oh my gosh, are they powerful?
Yeah.
So,
and that's an easy way for somebody to get started, right?
Yes, absolutely.
And I would also say the ointment is a big deal to have on hand. And then you can mix
out of stock right now,
the ointment with the oils. Yep. So it's
right.
Yeah. And you've mentioned
it is out of stock right at this.
Oh no, don't order it today. Wait a day or two. You've mentioned a couple of times, and I think people get confused by this. They see the animal scents and think that only the animals can use it. or they see the kid scents and think only the
Right.
kids can use it. Because everybody last month, when all the kids scent stuff was part of the gift with purchase, they're like, what am I going to do with this? I don't have any children. I'm like, use it for the dog. Use it for yourself.
Yeah.
They're like, you
right.
mean I can do that? I'm like, yes, you can. I use the animal scent ointment on my sunburned lips if I've been down to the beach, or on my
Mhm.
feet. You can use the animal scent ointment on the paw
Right.
pads of your dog if they've hit the asphalt and it was too hot. We shouldn't be doing that, but you never know. Or the little snow dogs, then their little feet get little snow burns
Mhm.
on them, or what. There's just so many,
Right.
many benefits to it. So
Chapped elbows and heels and all that.
yeah.
Mhm.
So, I mean, bottom line is there is an essential oil that we can use for everything, even if it's the emergency pigs out on the road or the emergency drive to the veterinarian. There are things that we can begin to do that will
Right.
benefit our animals. And in many cases, there are things that we can do that frankly lead us to not having to go the traditional route of vet care at all. We can work on a scrape or a boo-boo or even a puncture. We can work on a digestive upset. We can work on a limping leg or a splinter, or even surgical aftercare, right? I mean, I've
Correct.
treated many, and I can't use the word treat. See if I can edit that out. But I have many times when somebody's had a surgical procedure, like when Poppy blew her knee out
Mhm.
and had to have that repaired, I did not use the medications that came home with her. Now, sometimes it's easier to just say thank you very much and go home with them and not use them than it is to have that argument. But I used the ointments and the oils and healed that little leg up. So
Well, and I was going to talk about ACL injuries because I think these are really important too. Is most vet clinics are not going to rush. It's not an emergency procedure, but that dog is very uncomfortable, even if it's been given some conventional been given some conventional medications, say like Previcox, Rimadyl, or Medicam, whatever. And so I find that Deep Relief is an excellent oil to roll right on that ACL tear.
yeah.
And then if you use a little lemongrass and maybe even a little Copaiba on there 3 or 4 times a day, it's going to help that area with the inflammation and also with the pain. So yeah.
And I've done that countless times with her, because you know that if we blow one leg, they've said we're likely to blow the other. Well, I've been able to not have that happen for her, and she's now 6.5 years old.
Good.
And she blew the first knee before she was 1. And so we spent a lot of time working on that second knee and the recovery of the one that was surgically repaired. We spent a long time working on both knees to sort of build them back up and strengthen and help her do that. But she takes BLM, that kind of stuff as well as part of her supplemental routine. So
sure.
Anywho, anything else you want to share with us? I mean, we've kind of been all over the board today.
It's good though. It's good.
It was good.
Yeah.
So folks, if you have questions, let us know. And I have a first aid list out on my blog that says all the things you need to have in there. It does not have a stethoscope on it though, because I've looked at purchasing them and I thought, do I really know how to use this? But you made it sound easy enough for me to understand.
Yeah, like I said, you don't really have to be a doctor. You just need to know if that heart is beating really hard or very fast or very faint. If you've got a situation where it looks like an emergency, and then you can call your veterinarian and go like, I can't hear a heartbeat very well.
Yeah. The other thing that I would say is just sort of a final point for me is if I go to the vet, and I can't even watch the shows on TV anymore because this happens way too often, where somebody goes to the vet and they say, we really don't know what's wrong, but here's some antibiotics and some steroids. Go home and see what happens. I want
that's a
people to say, no, I'm not going to do that. I'm going to go home and see what happens with my natural wellness approach, right?
correct.
I'm going to,
Yeah.
based on whatever we think the theory might be, support using essential oils and supplements in that category versus jacking up the immune system too by winging it with by winging it with steroids and antibiotics. There's a time and place for those, but if we're saying we don't know what it is, I'm not sure that's the right approach.
Correct. Well, and here's, I'm just going to end up with one little story. This happened to a family member of ours. He has a little French bulldog, Lucy, and Lucy this winter was, the garbage truck had come and Lucy was licking the snow where the garbage truck had been. And then Bruce called her in right away. And then that afternoon, or I guess it was immediately, she just acted kind of lethargic and wasn't wanting to jump on and off the furniture or anything. So we took it into the vet, and because of COVID, of course, they had to do curbside service. And so Bruce had given them a history of what had happened with Lucy. And so they did $400 worth of work on her and sent her home on some kind of anti-inflammatory for her gut, and told him to watch her. And Bruce calls, she's not any better. The next day he says, she's not any better. She's really having trouble getting around. I'm like, she just wants to lay around. And so I questioned Bruce. And what happened was that Lucy apparently slipped on the ice and tweaked her back. It was a back issue because through extensive questioning and watching her, I had him send a little video of her walking. Sure enough, she slipped on the ice, and it wasn't anything that she had ingested, no poison or anything. But here again, it's like, I gotta watch. I don't want to put my foot in my mouth here. But you as a dog owner, and I'm talking to your audience here, you as dog owners your animal better than anybody else. And if the dog is not walking right, a lot of times veterinary clinics are so busy that they're in one room, the veterinarians here, there, and doesn't get a full history, doesn't do a full examination. It didn't take me even long to figure out that this dog was not poisoned by the way I watched her walk. Oh yeah, she tweaked her back. I gave him ideas for Copaiba, deep relief, lavender, and I think marjoram to stop the muscle spasms. And in 36 hours, she was perfect. So, yeah.
And I'm just going to say this too. I think this is part of why we have to be uber careful in some of these Facebook groups where somebody goes in and says, my dog was out by the garbage truck, and suddenly 42 answers are flying out, and nobody stepped back and questioned what else is going on. What do you need to, there's so many variables and so many, it depends. And people get frustrated with me all the time when I'm like, I can't answer that here. I need to know more information.
Right.
And I'm not going to just wing out some answer like 72 other people do in a Facebook group, and then people wonder why their dog's a hot mess.
Right.
So be careful. Nurse Google and Dr. Facebook are quite interesting.
Yeah, they can be, Dana. You're right.
All right. Last call, Dr. Barb. Any other details or things to share?
I think we're good.
Okay. All right. Well, I thank you very much for your time, and friends. If I can help you in any way, please feel free to give me a call. In my Facebook group, might tell you it depends, but we're going to help you get to the right answer, even if that means calling Dr. Barb for a holistic consultation. And I don't think we've mentioned it yet, but her website is Barb Fox, DVM, doctorofveterinarymedicine.com.
Thank you, Dana.
All righty.
Yeah.
Hi, these podcasts are for educational purposes only. We are not here to diagnose, treat, cure, or prevent any specific disease or illness. You are encouraged to do your own research and consult with your veterinarian or holistic practitioner regarding your pet's individual care.